Did you know that managing your blood sugar could impact your brain health? So, today we're going to talk about the link between diabetes and dementia. So, you all know that I'm a nurse practitioner, and sometimes when I'm seeing a patient or talking to a family member, there are things that are too good not to share. So, today I had great conversation around diabetes and the link to Alzheimer's. And the patient's family member asked me, is there a link? Do I need to worry about this? I inherited my mom and dad's diabetes. So, diabetes, particularly type 2, can increase the risk of developing dementia because when diabetes occurs, the body is unable to make enough insulin or it doesn't use the insulin that you're making properly. So, think of your brain sort of like a light bulb. Proper blood flow keeps the light on, but when uncontrolled diabetes, what would be like the wires in a light bulb, get damaged, that light starts to dim over time, which is kind of the same. When your diabetes is uncontrolled and your sugars are way high one day and extremely low the next, but in particularly when they're higher, and your vessels get damaged, obviously that's going to reduce blood flow to the brain and it's going to cause some issues. So, what do we know right now? Well, we all know that the number of people with Alzheimer's is going to increase monumentally over the next 10 to 15 years. But so is the number of people with diabetes. 37 million people in the US have diabetes, and this number is on the rise. So, what does that mean? Is there a link? Well, yes and no, because studies have shown that diabetes can be a risk factor for Alzheimer's, vascular dementia, and other types of dementias. And that's because the same cardiovascular problems that increase the risk of type 2 diabetes also increase the risk of dementia. And those are obesity, heart disease, or a family history of heart disease, impaired blood flow to your vessels, circulation problems, cholesterol problems, and high blood pressure. So, is Alzheimer's disease actually type 3 diabetes? Well, while studies suggest that the brains of people living with Alzheimer's are in a diabetic state, partially due to a decrease in sensitivity to insulin. There's probably more similarities in the brains of people living with diabetes and in the brains of people living with Alzheimer's disease. Diabetes only really remains a risk factor. But some people with diabetes may develop dementia, but then on the other hand, some may not. So if you're caring for somebody with diabetes or you're a person who's inherited diabetes from a parent and they have dementia and you're caring for them and you're worried about that, like, oh, great, do I have a double whammy now? Is my increased risk for dementia because I'm caring for my mom who has dementia and I also inherit her diabetes? Does that make me more prone to getting dementia? Well, the good news is what's good for your heart is good for your brain. So obviously living a healthy lifestyle that promotes cardiovascular health will benefit your brain. So start eating a healthy diet that's rich in vitamin D, folate, B6, and the B12 vitamins. If you're able to exercise regularly, both your mind and your body. And I know some of you are going to say, but I'm caring for a parent or I'm caring for a loved one. How do I do that? 15 minutes of light exercise or 15 minutes of body movement, you might be able to squeeze that in your morning or in your evening. Stay socially active and challenge yourself daily, and make sure that if you're a person who's playing sports, because sometimes as a caregiver we can play sports, just make sure you're protecting your head. So while we're not able to reverse technically the damages of any of the dementias, it's really never too late to start protecting both your body and your brain, because small changes can make a big difference, even if you just start them today. If you want to learn more, follow me for more insights and tips on dementia caregiving.